we have some prospective students on the call today, as well as representatives from Stephens College. I'm Dr. Julia Moffitt. I'm the Dean of Health Sciences here at Stephens College. And I kind of want to introduce who's here. So then if you have questions that come up, you can just ask us. You can use the chat channel, and we'll make sure we have plenty of time for you to have any of your questions answered. From admissions, we have Sally Bollinger, who's here to answer questions. There's Sally. For financial aid, Alexandria Miller can answer any questions you have there. And then we have our nursing faculty, our director, Dr. Noreen Hauk, and Felicia Ananubi, who's here to talk about all things nursing. And then we have some of our admissions counselors, Xander, Sydney, Madison, and Alex are here. And then I believe Joe Enright's, he is on our staff as well, who's kind of sitting here to help learn more about the program and how we're doing this. So this is one of our early Zooms for the nursing program. We just got our official word on Monday. So we wanted to have some, because there is a short window of time here. We knew we might only have a couple students in these first few, but that's okay. We want to make sure that everyone has as much time as they possibly can to make decisions. So Stephens College, and Tracy can talk, she knows all about Stephens College. Tracy's a grad from Stephens College. We're the second oldest women's college in the country, undergraduate residential women's college. We do have co-ed programs for our graduate programs and online programs, but the nursing program is designed to be an undergraduate women's residential program. And our missions: learn, grow, and lead. And you're going to see those themes in the curriculum for the nursing program. So, you know, a lot of things we at Stephens College believe in are developing women who are resilient, optimistic, faithful to the traditions of the 10 ideals, and that are really eager to embrace the future. And you're going to see that I think when we're done looking at the nursing curriculum, it's designed to help cultivate those experiences and qualities in a Stephens woman. We believe in a commitment to each and every student as a unique individual. And by design, the program's small. We right now have a max capacity of only 24 students, and that's by design, so we can do that. And so I think that's going to be an advantage you're going to see as a potential nursing student in our program. You will get a lot of hands-on time attention with such a small cohort. So we're building on the strengths of the health science, the School of Health Science. So nursing is going to be housed within the School of Health Sciences. We're kind of building on what we have been able to achieve through our Master of Physician Assistant Studies program. I believe we're about ready to admit our 5th class for our PA program. Our first 2 cohorts graduated. Both cohorts had 100% PANCE board pass rate. And I can say without a doubt, that's incredible, because this is the 3rd PA program I've been associated with. I've not ever seen that, let alone in 2 inaugural classes. And I do know, and I think this has to do with nursing. Board preparation, at the end of the line, you've got to pass the NCLEX exam. And there are certain resources and ways in which the curriculum and the resources are structured to help facilitate student successful passing of that licensure exam. And I think past performance is a prediction of future performance. You can see that Stephens College invests in that quality of making sure our students can pass their licensure exam, because that's really important that we be able to do that. So I think hopefully our PA track record can kind of speak to that. Some of your classes will be in Sampson Hall, which we have a clinical skills lab, as well as our state-of-the-art anatomical lab. So you'll be in there utilizing those resources. It's a beautiful building. Tracy, were you ever in Sampson?
No, I was not. I have not been
okay.
in there. I had most of my classes with Dr. Haskins. So
right. Okay. Yeah. Yeah. And she's going to be part of teaching coursework within the program, so public health. So that's going to be we're really excited to have Dr. Haskins as part of that. But so some of the classes will be in Sampson Hall. Also existing in the School of Health Sciences that is going to be beneficial. Oh, go ahead. That's okay. We're getting excited.
It's my hot hand thing on this mouse.
Okay.
Yeah, we have a high watermark to reach with the PA program going ahead of us. So I think that's great. We have a great support system and a great environment to build a nursing program in the health sciences. So strong support courses for the program we're offering. I thought.
Can you go back real quick? I just want to talk real quickly about integrative human biology.
Oh, good. Right. Yeah.
So we have a new major, undergraduate major in integrative human biology, and it's designed for flexible preparation for all healthcare-oriented professions or graduate programs. So you can consider it a parallel pathway to our nursing program. It's sort of an ideal thing for students who, let's say, they want to spend a little bit of time before matriculating to the nursing program to take chemistry or something along those lines. Then if they transfer to the nursing program, it's a very seamless transition. Likewise, if we had students who went through the nursing program and they decide, oh my gosh, I really would rather pursue graduate school or something else, they can change over to integrative human biology and complete their degree in 4 years. It's not going to set them back any. So we designed that major for that. And then we also have students who just select that major because they want to be able to prepare for physical therapy school, medical school, or things along those lines. Okay, go ahead, Dr. Hauk. I'll hand it over to you now.
Okay. Sorry, Penina. So our faculty, I will be teaching in the nursing program, and Professor Ananobi, who has extensive experience as a family practice nurse practitioner and overseas experience in Nigeria, Ireland, England, a very exciting dynamic that you bring to us, and experience with geriatrics as well as women and children. She was a midwife in Nigeria. So welcome, Felicia Ananubi. So I wanted to share a little bit about what sets our program apart. First, it's a direct entry program. So that means that students are admitted directly to the program. It's not, some schools, many schools, probably most schools now have moved to a program where you are admitted to the college, and then either your sophomore or junior year, you're admitted to the major. So it's a second application step. At Stephens, we plan to admit directly to the major. So from that freshman year, you would be a nursing major and you will be taking nursing courses. Your first 2 semesters, you will have at least one nursing course. And then that first summer, you will start your clinical courses, and you'll have clinical coursework and laboratory coursework from that point on in the program. It's going to take 3 years. It's still 8 semesters, but you'll start in the fall and then go through the 2 summers following and graduate 3 years later in May. Those summers will be a lot of clinical intensive during the summer. And we have infused throughout the program culturally sensitive care with consideration for diversity and inclusion. And this is a theme that we have going throughout the program, along with a couple other themes that I'm going to bring up. For instance, the next one, experience. We are very happy to be partnering with both regional healthcare community environments, but especially Boone Hospital Center. The program will address patients and clients and health issues across the lifespan and across healthcare settings like the hospital or public health, community-based settings, schools, and levels of care, what I call acute care, which is hospital care, to lower levels of care where a client may not need as much care, like after they've been in the hospital and they're in recovery in the community setting, or long-term care, or health promotion before we become sick or need acute care. And we have designed a program where our graduates will be ready for the workforce, ready to take their NCLEX, and ready if they choose to go to graduate school. I think I'm jumping to again. There we go. I want to talk more about our experience, our partnership, with Boone Hospital Center. They are a magnet recognized hospital, and magnet recognition in the hospital means that that hospital values nursing care, that they went through this magnet recognition process, which is very stringent, and they have said, the accrediting agency, that this hospital meets the highest standards of care for nursing care in that hospital. In addition, Stephens has partnered with us, and they will be invested in our students. They're invested in their success and in creating opportunities for our students. So this is a fabulous opportunity. One of the things you want to look for in any nursing program is the quality of the experiences you will get, the type of experience, and the amount of experience that you'll get in your program. So Boone Hospital is creating for us a simulation center right in their hospital. They're taking one of their patient care units. So it's not just a lab off a classroom that has a patient simulator in it. This is a nursing unit. It's at least 4 rooms. There'll be a nursing center and a medication room. And then these 4 rooms are designed just like the patient rooms in the hospital, only there'll be a 2-way video system and integrated audio system, so we can record the simulations. The faculty member can be outside the room and adjust the patient's response based on how the students perform on the simulated experience. The value of simulated learning experience is students gain confidence, they can do critical thinking and clinical decision making in a safe environment, and before they're faced with that experience in the patient care unit. There's been a lot of research on simulated learning, and it's incredibly powerful. And one of the powerful pieces of it is not so much the functioning that you do in the simulation, that's important, but it's the debriefing that occurs afterwards with your instructor and your classmates. And you view how the scenario played out, and you discuss how we reacted, what our thoughts were, what information we were able to gather and make decisions. So the great thing is it's right in the middle of the hospital. It's not an add-on. It's part of this dynamic we're creating with experience. Boone is also opening their arms to our students. They're offering the patient care technician program, which the deadline is rapidly approaching, but anybody who would like to be a patient care technician, work at Boone Hospital, can apply to become, through them, so through their website, a patient care technician, and work 16 hours or more, however you choose, your hours, a month in the hospital taking care of patients. So you're actually part of their workforce and team. The class starts July 20th, and it's a paid class. It's full-time for those 5 weeks. And then you move in, when classes start, you move into the 16 hours a month. At the end of the program, they also offer that our graduates will be eligible is a nurse residency program. So like in medical school, you might have a fellowship or an internship. This is the combination of classes, so certain hours, like 4 to 6 hours of classes a month that you meet with your whole starting cohort. And then the rest of the time, you're orienting and working on the unit. So in addition to Boone Hospital, we have a partnership with Burrell Behavioral Health for some of our mental health care experiences, regional health departments. So at the same time in this program that we're getting acute care experience, and when I say acute care, I'm talking about hospital-based experiences, we will also be having community-based experiences with the health departments. So when we're talking like coronavirus now, a lot of that work, when patients are sick enough, they go to the hospital. But the tracking of it, the community assessment of it is happening through the health departments. So we'll be looking at where those infections are occurring and how to track the scope of those infections, and other community health issues, the quality of water, the quality of resources in the environment. One of the things about this experience, I think that's going to be really special and unique about our program, it's not a lot of programs you might see public health as an add-on in the senior year. We're integrating it throughout the program. So when you're talking about maternal child services, you're going to look at labor and delivery, childbirth, and child care in the acute care setting, in the hospital setting. But we're also going to look in the community setting then and work with the health department on what resources are available to support women and children in that community. We'll also have experiences at primary schools and at, physician offices or primary care facilities. So this is another area that I would recommend if you're considering another program, to look at how much experience that program offers you. For a bachelor's degree, it's 120 credit hours, and about half of those are all in nursing courses. The first nursing course, as I said, starts the first semester, and then we have clinical, we have laboratory, and simulation learning experiences. In the direct patient care clinical experiences alone, we have 844 hours. But when you add in the simulated and laboratory hours, we're over 1,000 hours of what I call applied learning experiences. I think not many programs have that much applied learning and high quality learning experiences in their program. We are looking at doing a holistic admission process. Anyone interrupt me if they have a question or need me to stop and take a question there. I can't see faces right now. Okay. We anticipate a holistic admission process. So we're looking at not one single factor being the deciding factor for admission to the program. I also want you to consider anybody who's applying to the program. You want to make sure that you would be eligible for taking the NCLEX and licensing exam and applying to your state for licensure. So visit your Nurse Practice Act, usually through your Board of Nursing for your state. And here's a link to the Missouri Board of Nursing. But if you just Google Missouri Board of Nursing, you'll find it readily. And also the National Council of State Boards of Nursing, or NCSBN, is the group that manages and writes the licensing exam, and all the state boards are members of that organization. So imagine yourself making history. We are a women's college, and this is our first inaugural class. We're looking to develop a diverse class of interesting individuals that can represent and embrace the cultural humility and social justice that we seek to put into our program, and that reflect our diverse student body. So people usually want to know the admissions criteria. So these are what we're looking for. 3 units of science. I'd like to see biology and chemistry and good grades in that. 3 units of mathematics, but in particular algebra. Standardized test scores, one of these tests would be preferred. And again, we're looking at your overall high school GPA or test scores. Not one measure outweighs another measure necessarily. We ask you to write a statement indicating your experience with healthcare, and then every student will have to pass a satisfactory criminal background check. Also, students at various times through the program may have to go through drug testing or repeat their criminal background check. That is to work in clinical areas. Students who have prior college experience could follow the admission criteria that we've laid out for high school students, or if you have 12 or more transferable credits, we'd like to see a GPA around 3.5. Again, I'd like to see that you have chemistry and mathematics. And if you're coming in as a transfer student, you may want to meet and share your transcript with me, and we can talk about what courses will transfer in and how you can develop a program plan going forward, since you would be transferring in certain courses and looking to take other courses. And again, a statement indicating experience with healthcare and a satisfactory criminal background check. So these are the costs of attendance. We have people from financial aid. Would anybody like to speak to this? Alex, maybe? Or?
Sure. So here we have our direct costs, which is what the institution will actually charge you. So you have your tuition per semester, your technical fee, and then the nursing program fee each semester. The indirect cost is actually going to be costs that could come up or you could incur during the semester. So room and board, it is an estimated amount there. Living on campus is an option for this program. So, you know, you could live in our dorm rooms and eat at our cafeteria, or you could appeal to live off campus. And so we do build room and board in, even if you live off campus, because you will have living and eating expenses. And transportation, book and supplies, loan fees, those types of things, those are all going to be costs that could come up. Financial aid is available. We do have merits, awards, scholarships available for our students who apply to the nursing program, and all of those are actually assigned on acceptance to the program. And so, you know, once you apply to our program, you get accepted to the program, then we would notify you of any scholarships you would be eligible for. And if you would like to fill out the FAFSA so you could see what you're eligible for in federal and state aid, you can do that. The application is still open. And so if you're looking at joining us for the fall 2020, I would definitely say go ahead and start that FAFSA process. So then we can start looking and seeing what you're eligible for on the financial aid side.
Great. Now here's our sample curriculum plan. Now the way it's laid out, I just want to show you, this is the entire first year. So this is fall, if you can see my cursor, spring and summer, and this would be the second year, and this would be the third year, and you see you graduate at the end of the spring semester in May. So in the fall and the spring semester, the freshman year, you're taking primarily your sciences and some liberal arts courses. There is one nursing course. It'll be our introduction to nursing course, and in the spring, it's basically an introduction to what nursing science is. Then in the summer, it's pretty intensive, and you're going to see these courses, practicum courses, throughout the rest of the program. So here we have our health assessment and our skills course. And Tracy, I think that you were talking about the foundation skill that's worked into this course. But the practicum piece, the clinical hours and the laboratory hours and clinical hours, patient care hours will be included in this practicum piece. And there'll also be simulation. In this course with health assessment, there's a lot of laboratory learning and basic skill development. So you're going to get your stethoscope before this course, you'll have your uniform at this point, and you know, the tools of the trade, you'll be ready to go. In the sophomore year, we get into more specific patient populations, and we also are introducing that public health element. So we take principles of public health, and that's with Dr. Mary Amanda Haskins. And again, more science courses, and care of adults is your, many students will call it the med-surg course. And again, we have this one practicum course where you are going to get experience in the lab, a lot of simulation experience, you'll get some public health experience, and a lot of hospital-based experience. And primarily looking at the traditional care of adults and what adult needs are that require acute care or public health care. The spring semester, we're focusing on mental health and again, care of adults. So that's your second adult care course, and a practicum that's going to include experiences in both of those settings, as well as clinical lab and public health for both those settings. And then in the summer, the focus is going to be on care of children and childbearing women and their families. We're also looking at epidemiology. We're going to look at health disparities, a lot of social justice themes throughout this segment of the program, and a very intensive clinical experience with 5 credits of practicum in Practicum 4. Senior year, the focus now turns to public policy, leadership, quality and safety, and critical care. So we've really stepped up the game. A lot more will be expected. At this point, you've got your foundational nursing skills, and we're asking you to do that at the same time you start looking at the healthcare system. And we're moving moving nurses' voice into more leadership discussions about the state of healthcare and nursing's impact. And then senior year, we're looking at the global impact of healthcare, and you will also have greater independence. You'll have a capstone practicum where you're working shoulder to shoulder with a professional nurse in usually a hospital setting. Any questions there about the curriculum? I'll move on and we'll have more question points. So that's pretty much the end of the presentation. I want to encourage you can find that sample curriculum plan and download it from our website. The student handbook will be up very soon on the website. And there's a link to the State Board of Nursing. And again, my hot hand went ahead off that screen. And then how to apply. So more about how to physically apply. We have lots of people here that can help us with that. Questions?
Thanks, Dr. Hauk, for going through everything. Hopefully everyone can see the care that we placed in developing the curriculum so that students can move through in 3 years, but not make it overly excessively difficult to progress through. Right. Mostly it's giving up your summers, but you get out there the workforce sooner. So
you're gonna love it. You'll be nursing that summer away. We will have clinicals both days, evenings, or weekends. So, and there might be more consolidated periods where you're getting your clinical experiences in. But it's still, it's 15 to 16 credits most semesters. So it's within the normal frame of every college student has a program about that many credits.
What questions do you all have for us?
Yeah.
We can answer anything. Or if we can't, we will find someone who can.
What are you thinking when you see the program?
Excellence.
That's right, please.
I will say, we not on the call today. We have a new faculty member starting in July. Dr. Kevin Flaherty is teaching anatomy and physiology. He's taught anatomy and physiology at Augustana College, and we hired him specifically to help teach our anatomy and physiology in our physician assistant program, as well as the nursing program. So he'll be teaching that summer A&P course, which was a high priority for me. I'm a physiologist and I've taught anatomy and physiology, and I've dealt with, students trying to progress through nursing programs, and A&P seems to be one where it can be difficult. They can get stuck. So I wanted to be certain that we hired someone who would really be dedicated to teaching clinically relevant anatomy and physiology for that summer, because it's going to be a very intense first summer for you. And we wanted to make sure you had quality education that went into that to help you get through that summer and prepare you with a foundation. It's, anatomy and physiology is the foundation of medicine. So that was just a high priority for me. So we're really happy
to write this program in an environment that has struck such a strong health sciences framework to build it around was a real pleasure. And going forward, there's so many opportunities that you know, the students and the faculty, we're going to be able to take advantage of. So with some of our simulations, we plan on working collaboratively with the PA on some learning scenarios so that it's very interdisciplinary. And the hospital, since we're already at the hospital, you know, we can get other disciplines to come in and do, play their role with the patient at the bedside. So when you have a multidisciplinary team, it's important as a nurse that we know what it is nursing contributes to patient care and can speak up and, you know, represent the patient in their needs in that environment. So that's just, yeah, I'm just so excited. It's going to be so fun. It's going to be awesome. Yeah, excuse me, Professor Anubi, you please jump in and, you know, contribute if you, something you would like to add to the program or what we're planning.
I was just responding to Alex's text. She was saying that she has the other nursing programs are different. And I definitely agree. I've never seen any program designed in this way. And the combination of everything in this program screams excellence, because it shows, it portrays nursing, this program, as a way to nurture young nurses to be leaders and to be able to be proficient after they graduate, before they graduate actually. Because with all the laboratory experiences and clinical experiences and public health incorporated into the whole program and not just at one point, which other schools of nursing do. So it's very unique and it's a selling point. And I have high hopes that people will really identify with this and be able to be drawn to the program the way it is designed. So thank you for the great job you did, and especially with with putting together skills and health.
Yeah.
Yes, the clinicals together, the skills with the health assessment, because those two go hand in hand. And when they are taught separately, it doesn't bring everything together as it would if they are combined. Because initially, when you told me that, I was wondering, how is this going to work?
Yeah.
Until I've actually thought through them and then looked through the textbooks that you selected. So thank you for that.
Yeah, well, I mean, the idea is to create a very a program for today, not for what it was 20 or 30 years ago.
Yes.
And then also the learning environment should match what we want to achieve in terms of the outcome, what the nurse has to do. So it's not about being in the lab. It's about what we are getting from that and translating that to practice. So we want to, you know, shorten that distance and not make it, this is a separate environment. You act differently when you're dealing with the mannequin. No, we will be in uniform. We're in the hospital setting. We will be nursing, and we will go from that experience to, it'll be integrated with what you're doing with your clinical experiences. So we're constantly trying to shorten that bridge to those experiences and those connections, and making it very today. You know, nobody wants a pandemic, but students from this program are going to be ready. You know, they're going to get it. It's not just what's happening in the hospital, it's what's happening in the community. We'll take advantage of a pandemic, but we didn't want it.
Our inaugural class will be able to say when they graduate, I became a nurse in the pandemic. They will. And they will absolutely be able to handle anything thrown at them. I mean,
yes.
And it's changing. It's going to change the way we do healthcare in this country, let alone institution by institution or system by system. And so we are going to be ready to, you know, see that change and respond with it. not after
Yes.
it, right?
Yes.
We'll be
Right.
part of that change. Yeah,
Yes.
Yeah.
that's exciting.
And again, the what sets us apart, that slide really spoke to me, and it really is a highlight of everything, because being admitted directly into the nursing program has not been the way that is it goes here, but it was the way I was trained. I went through Nigerian University of Nigeria Teaching Hospital. We were admitted directly into the program, and then we were working as patient care tech. So that combination with the nursing program really helps build up confidence in being a nurse, and being able to start early, in being able to do hands-on patient care, clinical, rather than waiting towards the end.
Yeah.
So that, and then again, the culturally sensitive care with consideration to diversity and inclusion says a lot about Stephens College, because that diversity is what we want to see, and that inclusion, provided knowing that you are there as a nurse to provide care and not to judge. So regardless of who your patient is or where they come from, that is not your issue. Your issue is to focus on taking care of that patient. So the emphasizing that also is a huge
Understanding them and their needs and their point of view, not from your point of view.
Point of view, yes, thank
Well,
you.
and there's considerable literature that shows patients who are cared by individuals that reflect their individual diversity respond better, and they have better outcomes.
Right.
So I think it's imperative.
Right.
The science is there. It's imperative that we produce and educate and include individuals in our programs that reflect the diversity of the patients that we're going to serve. It's important to outcomes. If you just want to look at the numbers, you can look at the numbers, and there's plenty of data to back that up. So
right, I mentioned social justice, but really from our point of view, we will be looking very closely at health disparities and what it is, and that's that leadership piece at the end. What is it in the healthcare system, in the structure of the system that we are part of, that is affecting those outcomes, those disparities, those gaps? And that's our job, to address that. That's what we're here for. That's, our job is to care for, our clients, define our clients. So
I was looking at the structure of it. I think the structure of the plan of study matches how a Stephens woman will learn. Like you said, the epidemiology paired with the care of children, and then you start off with the principles of public health and patho with the care of adults. I think for me, just graduating from Stephens, that's how I learned. I need to learn this and then hands-on with this and then match it
together, integrate it.
And I think I like it. I wish I could start off doing this.
You can.
You can.
You can.
Yeah.
I'm really glad to see you. We're really glad to hear you say that, Tracy, because Dr. Houck and I, we're somewhat new to Stephens College, and we stepped in, started thinking about creating the curriculum, and we wanted to make sure that it fit the culture of the institution, and because the culture of the institution is what drew us there.
Right.
It was actually pretty easy to do, in fact, and I think what you say is that's great. I'm glad to hear that.
Yeah, Dr. Haskins, she's really good with health disparities, and she's from Mississippi, so she knows. So she's really good with pointing out all the disparities and just matching it with how to care for someone, or just care for yourself. She's really big on the caring for yourself and mental health, which I think is important with nursing, because you get so frustrated, and you just have to realize to care for yourself, because that's the way you can care for another.
Tracy, those courses aren't even the nursing courses, so I was thrilled to say, oh, look at
Yeah.
This is in the other section.
I was like,
Yeah. Dr. Haskins helped us quite a bit in the shaping of the curriculum. Yeah.
Oh.
She's in our little quadrant of our offices.
Yeah.
Yeah. And I wanted to say thank you, a big thank you to Dr. Moffett for even thinking about bringing this program on to Stephens. Because without her innovative ideas, we wouldn't be here today. And then to add to what Dr. Hauk said about the social justice piece is very important in combination with leadership, because that will help develop nurses to be interested in politics. Because nurses rarely take part in politics. If policies are going to be changed and if disparities are going to be addressed, it is through politics. And if you're not actively involved in politics, there's no way you can affect a change. So understanding that piece of social justice will help to actually excite students and future nurses to be part of politics in order to address those social justice issues.
And I think that's something that really separates out a Bachelor of Science in Nursing prepared nurse versus an RN.
Yes.
Is that you develop that leadership to be able to lead, those skills, so you know what needs to be done, and then you have the power to help implement and shape and change things as a Bachelor of Science prepared nurse. And then we believe at Stephens College, you have that squared.
Yes,
those women in leadership position, those other skills that you just get as in the way in which you interact on campus with other individuals and classes and courses and things like that. So just the whole culture of the campus environment, I think, helps develop that as well.
Yeah, I mean, I've never met a campus, or been at a school that so embrace their core values and really worked it through the program the way I see the 10 ideals used at Stephens, so that it's, it was one of the first things that attracted me when I was looking at Stephens College as a potential place to land. I'm sure, Tracy, you as a student, what was your experience with that? Of the
10 ideals. What did the 10 ideals mean to you as a student, Tracy?
Not to put you on the spot.
Right?
Yeah. The 10 ideals really makes an independent woman. They stretch independency and stretch going for just being a leader. Stephens really stretches being a leader, and that's what attracted me to them. Like I said, I started off in fashion, and I just started seeing the STEM program actually progress so much that I was just like, okay, I want to, fashion will still be there, and I don't knock anyone still doing it or graduated and got that degree, but I wanted to further and just be a part of something bigger and be an actual leader in that type of environment. And then also I started working at MU Hospital, and I just liked all seeing what all the nurses did. I was like, I could do that. So
yeah, that's great.
They started, getting a PA program. Like I started in 2015, graduated 2019. And so they had the PA program. Then I met Dr. Haskins, and everything just seemed like just developing independency and developing ways to be a leader and how to just farther and further and further. Like a whole bunch of women graduate and get a lot of jobs. When I graduated with my degree in health science, I got a job at Cerner. So the whole, like, I went to a women's college, I studied this and I did this. And just applying that when you go out in life, you end up living by it because it's so rare. So,
yeah,
wonderful. Gosh, that's a great story, Tracy. I'm so glad to hear that. Yeah.
Thank you.
I don't always get a chance to talk to recent alums.
Yeah.
Because you all are so busy doing stuff. You're busy.
No, I didn't think I was going to get into the accelerator program so fast. I was just like, oh, I just graduated 2019, and I just started the May after that.
Well, I commend you though. You know, why sit around and wait? Go take
Right.
go do stuff. Heck yeah.
Yeah.
Mhm, mhm.
Yeah. Yeah, there's so many paths you can take in nursing too. I think that was always an attractive piece, especially when I was younger and thinking you want me to pick one thing, and most nurses do kind of change their route a couple times through. I started out in critical care and then ended up in maternal child, and so it evolves before I became a educator.
I know. I never knew I would be teaching nursing.
Right.
I've changed a lot from one place to another. I've done everything, areas in nursing. And I remember one conference I attended in Colorado, Copper Mountain. Loretta Ford, Dr. Howe, do you remember Loretta Ford? She was one of the first people that started nurse practitioner program.
Oh, right.
Yes. So I met her at the conference, and after talking to her for about 30 minutes, she said to me, "You need to leave practice and go teach." That's what she said. I said, "Oh no, I will never. No, I will never teach. I love being a nurse practitioner, this and that." And then guess what? 10 years later, 10 years later, here I am. And I said, oh my God, why did it take me this long to be a faculty, to go into teaching? So you can do anything you like in nursing. So
yeah, it's a career. It's definitely a career path. Well, I have to jump off. I have a meeting at 1, but it was terrific to meet you all and talk about the nursing program. And if you have any questions at all, feel free to contact me or Dr. Houck or anyone on the call that can answer any particular question you have. So.
And Tracy, I know you're in a unique situation with your classes. I'd be happy to set up a time to, look at how the program might fit your situation. I think that would be fun.
Yeah, I wanted to ask you, like, how do you feel like alums fit into this program, or people that want to go back for nursing? Like, how do you? Well, we can talk about that. Yeah, I want to ask.
Yeah, you can.
Or we could just.
We got a plan for that.
Yeah.
Yeah, you guys go ahead and talk about that. Thank you. It's nice to see you.
Good to see you, Julia.